Hi, I'm Erik Christensen from the NLS Norway Relocation Group, and I want to welcome you to this advanced briefing for global mobility managers, HR directors, and talent acquisition leaders. Today, we need to address a profound cultural and administrative friction point that consistently blindsides international talent arriving in the Norwegian market. We are talking about the healthcare disconnect. When recruiting top-tier executives from jurisdictions like the United States, the United Kingdom, or Singapore, corporate HR departments often sell the Norwegian relocation on the promise of a safe, high-functioning social democracy with universal public health care. On a brochure, this sounds like a massive benefit. However, I'm here to warn you that moving an international executive from a premium private concierge-level medical system into the fiercely egalitarian Norwegian public health sector is a recipe for deep psychological shock, family anxiety, and significant corporate distraction. To understand this crisis, we must look at the fundamental difference in healthcare philosophies. In many global corporate hubs, healthcare is treated as a premium consumer service. A high-earning executive expects immediate access. If they have a minor joint ache, they expect a next-day MRI and a direct appointment with a top orthopedic specialist. In Norway, healthcare is viewed as a universal public utility, governed by strict triage and a gatekeeper system. The bedrock of this system is the Fastlege, or general practitioner. You cannot simply call a specialist or a private clinic without referral from your assigned Fastlege. The first major wall your international hire will hit is the digital health barrier. As we have discussed in previous briefings, an expert cannot log into helsenorge.no, the central digital health portal, without a full functioning bank ID. Because securing a bank ID can take up to 12 weeks, the newly arrived executive and their family are entirely locked out of the digital healthcare infrastructure during their most vulnerable transition period. They cannot digitally register for a Fastlege, they cannot view their children's vaccination records, and they cannot request digital prescriptions. This administrative void causes immediate panic for parents. Even once they secure a Fastlege, the cultural shock of the medical consultation itself is profound. The Norwegian medical philosophy is highly conservative when it comes to intervention. It is heavily focused on watchful waiting, natural immunity, and minimizing the use of antibiotics and unnecessary scans. When an American or British executive brings their feverish child to a Norwegian doctor and is essentially told to go home, rest, and drink water, they do not view this as prudent medical practice. They view it as a negligence. They feel the system is failing their family. This feeling of powerlessness rapidly transforms into resentment toward the company that relocated them here. Furthermore, we must address the reality of the Fastlege shortage in major cities like Oslo, Stavanger, and Bergen. Public waiting lists can be extensive. For an executive whose time is literally valued as thousands of kroner an hour, sitting on a waiting list for 3 weeks to get a basic referral is viewed as unacceptable friction. This distraction bleeds directly into their professional output. If your senior manager is stressed about their spouse's unaddressed medical issue, they're not focused on your Q3 deliverables. This healthcare disconnect also extends deeply into the Norwegian workplace culture, specifically regarding the egenmelding system or self-certified sick leave. Norway operates on a profound level of social trust or tillit. Local employees are legally entitled to take days off for their own illness or their children's illness without an immediate doctor's note. For foreign managers accustomed to high-pressure presenteeism, a corporate culture, this high-trust system is incredibly jarring. They often misinterpret Norwegian employees' use of egenmelding as a lack of dedication or outright laziness. If the foreign executive reacts aggressively or suspiciously to this, they instantly shatter the trust of the local team, destroying their ability to manage through consensus, what we call forankring. At NLS Norway Relocation Group, we help strategic HR departments bridge this massive gap through preemptive medical expectation management. You cannot simply drop an executive into the public system without a roadmap. We advise our corporate clients on the critical necessity of providing behandlingsforsikring or supplementary private health insurance as a standard component of the executive offer letter. This private top-up allows your hires to bypass the public queues for specialist care and physical therapy, providing the concierge safety valve they expect. More importantly, our on-the-ground consultants physically assist families in navigating the transition. We help them secure temporary medical access before their bank ID is approved, decode the Helsenorge portal once it is active, and provide deep culture coaching on the Nordic medical philosophy. We also train foreign managers on the legal and cultural nuances of the Norwegian sick leave system so they can lead their teams without creating unnecessary friction. If you want to protect your multi-million kroner talent investments, you must treat their physical and psychological well-being as a strategic corporate priority, not a public sector afterthought. Let us help you manage the healthcare disconnect before it becomes a retention crisis. Please visit our website at nlsnorwayrelocation.no, nlsnorwayrelocation.no, to learn how our comprehensive corporate solutions can safeguard your global talent transition into the Norwegian system. We look forward to being your partner and building resilient support teams.